Hi, Pam from DCD Insurance Services with an easy to understand look at Medicare Supplement versus Medicare Advantage. Right now it's open enrollment for 2022 and there's a million ads on TV. People are getting bombed on their phones with mailers about all these great plans with all these great extras, and a lot of people are very confused. First of all, Medicare Supplement and Medicare Advantage are like two totally different worlds. Never confused that they are anything alike. So let's talk about what they are and the pros and cons of each. So there is no like one right answer that is a great fit for everybody. It's not a one size fits all sort of solution. So let's take a look at Medicare Advantage. So Medicare Advantage plans are private plans through private companies that Medicare, once you go to one of these plans, basically says, here, company that you chose, here's the money that they've been playing into Medicare, and you take care of them. The pros of these plans, so you can make a column of like pros and cons, is that they usually have a very low monthly premium. Some of them are even no cost. They have extra benefits like dental vision, but you need to evaluate if your dentist will actually take it, because oftentimes we find that those benefits are not, while they are there, they're not usable in your area. They have special needs plans for those people who maybe already have coronary disease, cancer, diabetes. There are some areas that have specialized plans for those people that might have some unique benefits for that group. And drug coverage is almost always included. So that is the pros of those plans. Okay. The cons. They have network restrictions. So they're usually a much smaller list of doctors that you need to be able to stay in. Many of them are HMOs, where you have a primary care doctor that you need to go to get your referrals to the other services, and they will refer you to doctors also within that network. These plans have co-payment. So each time you go to the doctor or get a service, you have a copay that you need to meet. Oftentimes no deductible, but don't equate that in your mind as free, because you still have a copay to meet. These copays can add up, and they all have a maximum out-of-pocket cost. So if you went into the hospital, you had outpatient services like chemotherapy, radiation therapy, infusion treatments, you might be paying 20% of those costs up to a maximum amount out of your pocket. Oftentimes I see that that's in the $5,000 to $7,000 range. So you could be out a lot more money, even though you had a very low or free premium. And these plans do change annually, so you'll need to shop them every year. So a sample of who might be a good client for a Medicare Advantage: all of your providers are in one network. I think they're all with Sutter or Dignity Health or Kaiser, but they're all together in one grouping. They don't tend to travel to see friends and family for extended periods of time out of the area. They're not high-end users like, again, chemo, radiation, those sorts of services. They want and can use the extra benefits that are in those plans, and they like a certain, no volatility on the premium. And that's a concern for people. Oftentimes I find that people who are on the older side of Medicare, more of a fixed income, this can be more of a benefit for them. Medicare Supplements. Now that red, white, and blue card that you've been paying for the government is in charge. They're making all the decisions, and your Medicare Supplement, kind of like the pooper scooper at the parade that just follows behind Medicare and picks up the charges that are left behind to take care of you. So these work everywhere in the United States that takes Medicare. You can change the plans every year in California on your birthday with no underwriting, anytime with underwriting, and move from company to company if that benefits you to get a better price. They have predictable costs. Plan F pays 100% of all the holes in Medicare. Plan G, everything except the small Part B deductible, which this year is $203. So if you want more comprehensive coverage, more freedom of choice, the Medicare Supplement might be the track for you. The cons of Medicare Supplement, they're a little more expensive premium-wise than the Advantage plans, but don't discount them till you see what those premiums are. In my area, new to Medicare, $93 a month, and a Medicare Advantage plan, $59 or $79. So not a huge difference in price. Many times there are no extra benefits like vision or dental, but you can always purchase those things on the side, and many of the companies actually do provide an additional discount program for those kinds of services that you can take advantage of at no charge. If you have poor health and you were in a Medicare Advantage plan, you'd have to go to underwriting often to go into a Medicare supplement. And they don't have a drug coverage, so you buy an additional drug plan. But drug plans in California start at $7.50 and go up. The one that's best for you is the one that covers the medications that you take. And we can check that for you on an annual basis. So typical Medicare supplement client is one who doesn't want any volatility. They don't want to pay the co-payments. They want the lowest out-of-pocket maximum if anything happens to them. They maybe travel for extended periods of time. They have high utilization, or even my clients with the lowest utilization, there are some very low-cost Medicare supplements that might work for them. And they want that more unrestricted network of doctors. So that's kind of the big differences. Other considerations might be if you are a couple. Oftentimes, if you're both in a Medicare supplement, there's a household discount. There are not discounts for households in the Medicare Advantage world. If you go to a Medicare Advantage plan, you have a 1-year trial, which means you can stay on that plan. And if for any reason that you don't like it, you can hop back to your Medicare supplement, and that would be guaranteed to you. But after that 1 year, to go to a supplement, you might have to answer health questions and go through underwriting. Oftentimes, I find the person who just got a new diagnosis of cancer or heart disease is the person who's asking me about getting out of the Medicare Advantage plan so they have more options for doctors. And we find out that health-wise, we're not able to underwrite them into a new plan. So it is a little more restrictive on the Medicare supplement, or on the Medicare Advantage, excuse me. But there are special enrollment periods that you can take advantage of. So if you happen to live in one county and you have a Medicare Advantage plan and you move to another county, you will be discontinued from the Medicare Advantage plan you're on. And that letter that says you're losing coverage that you think is horrible is actually your Willy Wonka golden ticket to get anything you want. So that would be a special enrollment period. People moving into the area new. People going through a loss of Medi-Cal, people who are moving in or out of employer-based coverage. So if you need any help with any of that, please give my office a chance to earn your business. We're at 831-423-8542, 831-423-8542, and we do not charge for any of our consultation services. So thanks for listening. Hope you found this helpful, and we hope to talk to you soon.